Hello everyone, we're Group 5 and today we're going to be talking on how to be an effective leader in the healthcare sector. My name is Anas and my teammates are Nargis, Tiffany, Atunchi and Puzi. Now let's introduce. In the healthcare field, an effective project leader is more than someone who simply manages tasks and deadlines. They are the connectors, the person who brings together medical professionals, administrative staff, and technical teams to work toward one shared goal. Now for the role, they have to set a clear vision for the project and align the teams. They have also to communicate effectively across clinical and technical staff. They have to coordinate diverse skills to achieve shared goals. Also, they manage time, cost, and quality while ensuring patient safety, as well as adapts quickly to challenges and changing priorities. Now let's take the first case study or example when Toronto General Hospital introduced a new surgical scheduling system. The project leader coordinated the surgeons, the IT staff, and the administrators to ensure a smooth transition by aligning schedules, optimizing resources, and improving communication. Patient time for the surgery dropped by 20% within the first 6 months only. Now for the second case study, which is in Vancouver during COVID-19 response. During COVID-19 pandemic, a project leader in Vancouver oversaw the rapid setup of mass vaccination clinics. They coordinated supply chains, scheduled staff, and implemented safety protocols, all under 2 weeks. Their leadership ensured thousands of residents received vaccination quickly and safely. And the other case study we have is the one for rural Ontario, where they introduced the telehealth expansion. In rural Ontario Clinic, a project leader guided the integration of telehealth services. They trained staff, coordinated with IT teams, and ensured the technology worked smoothly, allowing patients in remote areas to connect with doctors without traveling long distances. This improved access to care and reduced appointments cancellation. That covers the key responsibilities and impact of an effective project leader in healthcare. Next, my teammate will provide deeper insight into how project management strategies improve healthcare outcomes.
We can refer to PAMPOP 7 on what leadership is. In terms of the principle on leadership in PAMPOP 7, leadership is about guiding the team toward outcomes by building trust, empowering the team, and promoting collaboration with stakeholders. I will relate to team performance domain and stakeholder engagement domain. I will explain why they are important in being an effective leader in healthcare industry. Leadership in PAMPOP 7 is about vision, creativity, motivation, enthusiasm, encouragement, and empathy, not just authority. To demonstrate leadership, leaders should model the behaviors you want the team to follow, which includes honesty, fairness, and ethical conduct. Also, it includes inspiring, motivating, and engaging team members. It is important in healthcare industry because healthcare projects often involve ethical considerations, which impact patient safety and regulatory compliance. Team performance domain focuses on building trust and providing direction of the team and project. Strong team performance is essential to achieve effective leadership. In healthcare, this means fostering collaboration among teams, encouraging communication, and resolving conflicts to achieve a common goal to enhance hospital systems, patient care, and strategy. Stakeholder engagement domain focuses on identifying, engaging, and reporting to stakeholders. In healthcare settings, there are different stakeholders, including physicians, other health professionals, and admins. Project leaders need to guide multidisciplinary teams toward shared goals. Effective leaders need to apply different engagement strategies based on stakeholders' influence and interests to maintain positive relationships to ensure project success. Strong leadership is needed to influence and align stakeholders,
There are several
especially
types
in
of
complex
leadership style.
healthcare projects.
The first one, transformational leadership. We have transactional leadership style, servant leadership, autocratic leadership, amongst many other type of leadership style we have. And an effective leader should be able to switch between this style based on the situation that arises. The first one is transformational leadership. This is a leader that inspires and motivates teams to go beyond their immediate task by focusing on shared vision and innovation. In healthcare, in particular, this is the type of leader that encourages nurses, doctors, and administrators to improve processes, adopt technology, and engage in a continuous learning. An example is a hospital director leading a digital transformation to integrate AI-assisted diagnostic tools while fostering staff training. Another type of style of leadership is a transactional leadership. This is a leader that focuses on structure, clear tasks, and reward or punishment to ensure compliances. In healthcare in particular, this is a type of leader that often applied in high-risk environment, like during surgery. A leader has to um, motivate the people they're depending. An example is an ER supervisor who evaluates staff performance. The third type of leadership we're talking about is servant leadership. This is a leader that prioritizes the needs and growth of team members before organizational goals. A leader that supports staff's well-being and development, leading to higher job satisfaction and better patient care. Example is a nurse manager that ensures that their staff gets proper rest, mental health resources, and professional development, which will in turn increase their productivity. And the last type of leadership style we'll be talking about here is the autocratic leader. This is a leader that makes decisions independently with little team input. Can be effective in emergencies where immediate action is required, but risk lowering morale if overused. Example is a trauma unit leader making quick calls during a mass casualty event without waiting for consensus. So an effective leader should be able to switch between these different type of leadership style based on the situation they find themselves in. That is one of the quality of a good leader in healthcare.
To highlight these different leadership styles, while tying into the PMPOC principles and the healthcare project context, we decided to use a case study of the pandemic, right? So expansion of telehealth during these times. So the challenges that was faced during the pandemic was urgent need for deployment to maintain patient care during lockdown, clinician unfamiliarity with virtual platforms, privacy and cybersecurity requirements under strict timelines. And to navigate these pressures, the project leader, or I feel like the healthcare system as a whole, which you would look at, I feel like within the government specifically, medical admins, they leverage different leadership styles at different stages for this. For example, the first one was servant leadership. So the leader prioritized the needs of clinicians and patients by holding listening sessions to understand workflow pain points, ensuring the platform was user-friendly and accessible. 2, you have autocratic leadership. So during critical system testing, when security vulnerabilities were found, the leader made immediate top-down decisions to pause deployment until fixes were implemented. This protected patient data without lengthy debate. 3, we have transformational leadership. So the leader inspired staff by reframing telehealth as a way to reach more patients than ever before. They painted a vision of healthcare beyond the pandemic. 4, we have transactional leadership. To maintain momentum, the leader implemented clear performance expectations, such as completing mandatory telehealth training, and providing immediate feedback and recognized when milestones were met. The BEMPOC link, we looked at symptoms thinking principle plus the team performance domain and the tools and techniques of that. So it was like the SWOT analysis to guide strategic platform selections, decision matrix to evaluate vendors' proposals, change control process to manage post-launch features requests. And because of that, the outcome is that telehealth platforms were like fully operational. Clinicians adopted the system, and patients' access to care increased despite lockdown restrictions. In the end, the lessons of this was that in healthcare projects, there's no single leadership style that works in all situations. Adaptive leaders know when to serve, when to direct, and when to inspire, and when to focus on accountability. And so to be an effective leader in healthcare projects, you have to combine project management skills as well as the art of human connection. The three most important actions you can take is engage stakeholders early and consistently, apply structured BEMPOC tools to guide decisions and manage complexity, keep the focus on delivering value in healthcare. That means better patient outcomes. Leadership is not about authority, it's about enabling your team to deliver their best work for the people who need it the most.